performing the Trach suctioning skill. First thing that I would like to acknowledge is that I have performed hand hygiene before entering into my patient's room. The next thing I will do is knock on my patient's door. After knocking on my patient's door, I will greet my patient and explain the procedure. After explaining the procedure, I will verify the order and the hospital policy form. Here is my cheat sheet that you all have given us, as there is no writing on it. Next thing that I'll do is verify the order and the hospital policy. For this skill, I will use two patient identifiers, which is the patient's name and the MR number. Here it says the patient is Jaguar J. Jones. Jaguar J. Jones. The MR number is 417-417-6352. 6352. My patient also has an allergy to penicillin. My patient has on a penicillin allergy ban. I will now ask my patient if they have any other types of allergies that I should know of. Now we'll remove my cheat sheet so that I can see. Next thing that I will do is I will gather all of my materials. Okay, I have gathered all of my materials for this skill. The next thing that I will do is check the expiration date on my saline. My expiration date states 12/5/2020, which means that I'm still able to use my saline. The next thing that I'm going to do is I'm going to position my trash can. After I position my trash can, I perform hand hygiene. The next thing I'm going to do is provide patient privacy. Now I'm going to raise the bed to a working height and lower the bed rails. I will now position my patient in semi-Fowler's position or high Fowler's position. Now I will don my PPE. The first part of my equipment is my gown. I do not have my gown. It was not given in my blue bag, so I will verbalize and demonstrate that I put it on. The next thing that I'll be putting on is my mask. In a normal hospital setting, I will leave my mask on, but I have placed it below my mouth so that you all could hear me speak throughout my video. Now I will put on my goggles. The next piece of equipment that I put on are my clean gloves. After putting on my clean gloves, I will now tell you all the need for the suctioning as I'm about to do my respiratory assessment. Some of the things that I will need to do this suctioning for is because my patient has experienced gurgling, drooling, restlessness, nasal secretion, and also because my patient has experienced adventitious lung sounds. So the next thing that I will do is I'll perform a respiratory assessment, and I will assess for the vital signs and the signs and symptoms for hypoxia and also hypercapnia. After I have done my assessment, I have found things that relate to hypoxia and hypercapnia are dizziness, lack of consciousness, lethargy, decrease in pulse oximetry, and also there will be a increase in the blood pressure and in the pulse. The next thing that I will do is I will put a towel over my patient's gown, so when I begin my suctioning, it will not mess up the gown or cross-contaminate. Throughout this procedure, it is important to note that the pulse oximeter needs to be left on the entire time. I would also like to note that the oxygen flow meter should be placed at 100% FiO2. The suction regulator should be placed at 100% to 100 to 150 millimeters of mercury, and it should not exceed over 180 millimeters of mercury. This picture demonstrates the bed unit typical in most hospital rooms. The next thing that I will do is I will now open my suction catheter tray. After opening my suction catheter tray, I will take off my clean gloves. After taking off my clean gloves, I will perform hand hygiene, and now I will put on my sterile gloves. After I put on my sterile gloves, I will pick up my saline. In a normal hospital setting, I will open this saline, but for the video purposes, I will verbalize that the saline has been opened. And I will also pick up my catheter. After picking up my catheter, I will attach it to my suction tubing. And I'll make sure that it is tight. As I pick up my catheter, I will insert it in my saline, making sure that it is lubricated. Now I will remove my oxygen source. Before I begin my suctioning, I want to hyperoxygenate my patient, and I want to do this with 5 to 6 breaths in a 30-second interval each time that I do this procedure. The first time, 1, 2, 3, 4, 5, 6. Now I will insert my catheter for suction. As I do this, I will push it in and look for any type of resistance or coughing. I am encouraging my patient to cough. So once I notice that, I will pull it out 1 centimeter. And now I will start my suctioning, and I will start to pull my catheter out. The next thing that I'm going to do is hyperoxygenate my patient. Again, 5 to 6 breaths, 30-second interval. 1, 2, 3, 4, 5. And I will dip it into my saline. And I'll repeat this procedure. Again, looking for any resistance in coughing, encouraging my patient to cough. Once they have, I will pull it out 1 centimeter, and I will begin my suction and my rotation. Next, what I will do is I will hyperoxygenate my patient for the last time. 5 to 6 breaths per 30-second interval. 1, 2, 3, 4, 5, 6. And I will place my oxygen source back onto my patient. I would also like to state that how much time do you wait between the passage? It is a 1-minute interval. And the next thing that I'm going to do is I would like to also state that I will watch my patient's vital signs and my pulse oximeter while I am doing this. My patient's SpO2 should not decrease below 90% or a 5% baseline. My patient's beats per minute should not increase or decrease 20 beats per minute as well. So the next thing that I will do is I will detach my suction tubing, and I will take off my sterile gloves, glove to glove. Now skin to skin. Next thing that I will do is I will dispose of my suctioning tray equipment. I will perform hand hygiene. And the next thing that I will do is I will put another pair of clean gloves on. And as I did not say earlier, what will make me stop in my suctioning would be the decrease in the SpO2, the decrease or increase in my beats per minute, or the 5% decrease in the baseline, in the 90% decrease, which was the SpO. Okay, and the next thing that I will do is I will assess my patient, auscultate my patient for any lung sounds, and I will compare that to my first assessment. Okay, so what I will document as my final step before performing trach care is I will document the difference between the two assessments. And before I close out my video, I would like to state that when I'm doing my suctioning, if my patient still has secretions between two passes, I will allow for rest and